A very hearty good afternoon and welcome to the session on the topic IVF failed. So, what to do next? We are glad to have our doctor Ankush Raut among us today to help us understand the topic and all the minute details about it. So, stay there till the end. If you have any doubts, any queries, put that on the chat box, like on the comment section, so that our doctor can answer your questions in the last of the session. So, stay tuned till the last. And now, doctor, you have the stage.
Thank you. So many times we feel that whenever the IVF fails, it's the end of road and pregnancy is not possible for us at all. Many couples go into the depression and they don't even try to go for what is next. And this is happening because of the very high expectation of the couple from the IVF treatment. In fact, definitely IVF can help us in many conditions to have a pregnancy. Like it can help us to have a pregnancy from condition like ovarian cyst, poor ovarian reserve, tubal blockage, uterine fibroids, to the very less count of sperm in a husband's semen. So in all such cases, even in the postmenopausal woman, pregnancy is possible with the help of IVF. With the help of IVF. But IVF is also one of the scientific technology which is not yet with the 100% perfection. Maybe in the future it can come up with the 100% perfection, but as of now, it is a technique where 100% success rate is not possible, and this is the real thing with the IVF, that IVF can help you to get faster, can help you to have a pregnancy even in the cases where the pregnancy was not possible previously, but it is not always 100% successful. This is because of many limitations. There are many factors which can cause your IVF fail. In fact, let me tell you, if you are thinking that IVF is the thing, if it fails, that you will not be able to have pregnancy in the whole life. The success rate of IVF for the woman who is less than 35 years old, that is, I'm talking about the live birth rate, is around 54 to 60%. For the woman whose age is in between 35 to 37, the live birth rate varies from 40 to 50%. And similarly, for the woman whose age group, who are in the age group of 38 to 40, the live birth rate is 26 to 7%. While for the couple who is in between 41 to 42, live birth rate is about 13.8%. While the woman whose age is more than 43 years age, the success of having a live birth is 4.2%. So these are the realistic figure, and whenever we start for the IVF treatment, we should keep in the mind that these are the figures with which the success can happen. If we keep this in mind, then definitely after the IVF failure, we will not be shattered, we will not go into the depression. Rather than that, we will try to find out what went wrong and what we can do better in the next IVF cycle, or going for the next treatment which can give us the better chance of pregnancy. So before going for a next treatment, whenever the IVF fails, the most important thing is to investigate what went wrong, or what is the thing which we can change before going for the next IVF cycle. So most important investigation is, of course, to investigate for the ovary, for the fallopian tube, for the uterus, as well as for the sperm. IVF treatment can fail at many levels. Sometimes women may not respond to the injections like follicle stimulating hormone, luteinizing hormone called as the gonadotropin at all, and their ovary may not produce any good eggs. Secondly, there may be a follicular development, but sometimes they fail to give us the good egg, and sometimes there may not be egg in the follicle also. Sometimes there may not be a formation of good embryo, and even if the good embryo forms, sometimes the implantation also doesn't happen. So these are the many levels at which IVF can fail. So the most important is to investigate what can be the problem and what we can do better in the next cycle. So with the help of various techniques, like with the help of sonography, we can find out if there is any cyst in the ovary, if there is any problem related to ovary. Suppose if there is cyst or the endometrioma, then before going for the next IVF cycle, it is always better to remove the cyst or the endometrioma and then go for the next cycle. Sometimes after one or two IVF failure, we may see a collection of fluid in the tubes called as the hydrosalpines. So in these cases, it is always better to clip the tube before going for the next embryo transfer or next IVF cycle. Why it is important to clip the tube or remove the tubes? Because this hydrosulfings contains the fluid which is having a toxic chemical which many times have interfere with the implantation of embryo into the uterus, and hence pregnancy doesn't happen. There are many cases in which the tubal clipping has actually given them a pregnancy in a further cycle. Sometimes women may have a big fibroids in the uterus. It is always and always better to remove these fibroids before going for the next cycle. Sometimes you may have an endometrial polyp inside the endometrium. So this polyps, removal of this polyp will also help to improve the implantation. Similarly, in a male partner, there can be a very low percentage of good motile sperm as well as morphologically healthy sperm. So in these cases, we can go for some of the advanced technologies of good sperm selection, like for physiological intracytoplazmic sperm injections, microfluidics techniques. With the help of all these good sperm sorting techniques, we can actually select a good sperm and make them fertilize with the oocytes to get us good embryo. In investigation, one more important thing is when the IVF fails, there can be a genetic abnormality in the embryo. Now, this genetic abnormality can be tested with the help of test called as pre-implantation genetic testing, also called as a PGTA. And with the help of this PGTA, we can select the embryo which is having normal chromosome, normal genetic information, and this embryo which is having a normal genes can give us a better chance of pregnancy. Similarly, we can also opt for the ERA test, also called as the endometrial receptivity assessment test. This endometrial receptivity assessment test can tell us when the endometrium is maximum receptive. So, if the endometrium, and according to the result of this endometrial receptivity assessment test, we can plan the embryo transfer in a for future cycle to have a better chances of pregnancy. Similarly, a good hysteroscopy, investigating tool called as hysteroscopy, which is done with the help of small scope, which is inserted from your vagina into the uterus without cutting anything. And this hysteroscopy can help us to diagnose many conditions which is responsible for the failure of implantation, right? Like presence of polyp, presence of fibroid, presence of septum, presence of adhesions into the endometrium, sometimes a small endometrial cavity. All these things can be diagnosed with the good hysteroscopy, and this good hysteroscopy, along with diagnosing the condition, it can also help us to treat that condition in the same setting. So good hysteroscopy can also tell us and help us to have a better chance of pregnancy. Similarly, a good laparoscopy. Laparoscopy is considered as a gold standard for diagnosing any pelvic condition. With the help of laparoscope, we can diagnose endometrial cyst as well as we can remove the endometrial cyst. We can also diagnose if there is any infection inside the pelvis, which can be treated in the same setting. We can diagnose if there is hydrosalpinx, if there is abscess, if there is infection, if there is tuberculosis. We can also see if there is fibroid in the uterus, and all these things can be treated with the help of laparoscopy. So these few investigations, a good sonography, if required, a good MRI in order to diagnose the conditions of ovary, uterus, fallopian tube, as well as a good semen analysis, then good hysteroscopy and good laparoscopy, a test like PGT and ERA can help us to see what went wrong in the previous cycle and what we can do further in order to achieve the better chances of pregnancy. In the laboratory, there are now many advanced technologies available like ICSI, intracytoplasmic sperm infection, intracytoplasmic sperm injection. Now, we are always confusing between test tube baby, IVF, and ICSI. In fact, test tube baby is a term or is a technique in which can be done in one, two, or three ways, right? So one is the IVF where we suspend egg or the oocyte in a pool of sperm and we wait for this oocyte to get fertilized by the surrounding sperm. While ICSI is a technique also called as intracytoplasmic sperm injection is a technique where we choose the best possible sperm in a laboratory manually, and we insert this sperm directly into the oocyte. That is, we can confirm the fertilization in ICSI. So the basic difference in IVF and ICSI is, in IVF we are just suspending the oocyte in the pool of sperm, while in ICSI we are actually ensuring the fertilization. So naturally there are more chances that we will get a embryo, a healthy embryo with the ICSI as compared to the IVF, because in many cases where the husband or partner's sperm count is less, let's say less than 10 million, less than 5 million, in these cases IVF may not give us the embryo, while in ICSI, because we are ensuring the fertilization, which sometimes fails to happen in case of IVF with low sperm count, we can get a good embryo with this technique, even if the sperm count is less than 1 million, even if there are 5 or the 10 sperm in whole of the sample. With the help of ICSI we can do this. In many cases, so female partner is normal, female oocytes are good, husband's sperm numbers are also good, but still we fail to get a good embryo or fail to have a pregnancy. In most of the cases, husband's semen analysis shows that there are very less number of morphologically normal sperm. In some cases, even if the sperms are morphologically normal, still we doesn't get a good embryo, and it happens because of lack of identification of the sperm which is fertilizable, or the sperm which can give us a pregnancy. Now this hurdle can be overcome with the help of technique called as PICSI, or also called as physiological intracytoplasmic sperm injection. It is based on the principle that a sperm which is fertilizable, sperm which is strong, has a tendency to get stick to a hyaluronic acid. In fact, they are having a receptor for the hyaluronic acid. So using this same principle in the laboratory, we choose a sperm which is having the receptor for hyaluronic acid, and this sperm is considered as a fertile sperm, and they give us a better embryo as compared to a simple ICSI technique. So the couples, so the a couple in which the male partner is having a sperm count less than 10 million, or if they are having a sperm count where the morphology is bad, or where the motility is bad, or if they are having a recurrent IVF failure, in these cases this PICSI, that is physiological intracytoplasmic sperm injection, coupled with the IMC technique, can also give us the better embryo so as to improve the chances of pregnancy in the next cycle. Before going to next cycle, it is also very important to discuss what other advanced technology can be used for improving the success rate. The most important is the blastocyst culture. If in a first cycle, if you have done a transfer of the embryo which are at the day 3 stage, day 2 stage, then in this cycle, before going for the transfer, let's ask your doctor to go for the blastocyst culture, because the embryo, the blastocyst is a far developed embryo as compared to the day 3. Blastocyst is composed of mainly two components. One is called as the intracytoplasmic mass, inner cell mass. Another is called as the external cell mass, which is also called as the trophoectoderm. Now, this inner cell mass and external cell mass differentiation occurs in the day 5 embryo, not in the day 3 embryo. And all of the day 3 embryo cannot reach to the blastocyst stage. So the embryo which reaches to the blastocyst stage in a laboratory with a good differentiation has a better chances of giving a pregnancy as compared to a day 3 embryo. And also the blastocyst transfer is considered as a more physiological as compared to a day 3 embryo. So blastocyst is having a better chances of potential in a pregnancy. So in the next cycle we can consider a blastocyst. Secondly, we can also consider a laser assisted hatching. With the help of laser, because embryo has to hatch out in order to stick to the endometrium. If it doesn't hatch, then it doesn't give us a pregnancy. It will not give us a pregnancy. So what we can do with the help of simple laser, we can cut a small part of a covering of the embryo, also called as a zona pellucida, so that it can easily come out of the cells without harming any of the cell in the embryo. So with this laser assisted hatching, we can help embryo to get hatch out and stick to the endometrium. Apart from this, in many cases, we have to consider different protocols rather than going ahead with the same protocol in every cycle. Nowadays, antagonist is very popular protocol, but apart from the antagonist, there are many protocols which has a good success rate, like agonist protocol, the IVF flight protocol. In some cases, we may need to consider for the third party donation program. In some cases where ovary of the oocyte fails to produce any good eggs, or if the female partner is having some genetic abnormality, or if female age is more than 40 years or 42 years and not producing any of the egg in the follicle, or if she is having a recurrent IVF failure, in these cases donor oocyte program can also be considered. Now the chances of success we have seen are dramatically increased if we use a donor oocytes in all these cases. So it is very important to investigate first of all why the first IVF failed, and accordingly we need to act. So if we investigate appropriately, we take the appropriate step, we take the appropriate decisions at an appropriate time, consider different protocols or the protocols which can give us the better chances of pregnancy, then definitely once one IVF is not going to be an end of road. Even if you go ahead with the next IVF cycle with the IVF cycle or the ICSI cycle with the advanced technologies as well as the advanced stimulation protocols with the proper investigation, then definitely you can have a pregnancy even if the first IVF cycle fails. So in nutshell, IVF, one IVF failure, two IVF failure, three IVF failure is not the end of road. There are many techniques, there are many advanced technologies now in this era which can help you to have a pregnancy in recurrent IVF failure cases also. Thank you all. Is there any questions? Okay. So thank you all. So whenever you have a IVF failure, it is um, there is there is no need to get nervous or get depressed. You, in fact, it's the time when you should investigate. You should try to find out what went wrong and go ahead. So whenever you have IVF failure, try to meet your fertility consultant as early as possible and try to find the way ahead. Thank you. Thank you. Best of luck.